Thank you very much for taking the time out of your schedule to chat with us here with Spotlight TV for a special edition, Making a Difference, here with Sick Kids. Tell us about your story here. Tell us about Avery. When did you find out about this rare genetic disorder?
Avery got diagnosed approximately 2 years ago, so she was 2 years old. We brought her to Sick Kids because she was getting really, really high fevers every couple of weeks, unexplained. It led to multiple tests, blood tests, MRIs. They couldn't find the reason, so eventually they did genetic testing, and we found out she had a very super rare neurological disorder, which unfortunately is degenerative, and it's called spinocerebellar ataxia type 28, or SCA28 for short. We were told at that time that it would be very mild to moderate and probably wouldn't affect her until adulthood. That's obviously not what happened. Within months of the diagnosis, we saw significant changes, and they just kept coming from then until now. So Avery has lost almost all of her functionality, pretty much. She's got a lot of organ failure. She's got brain atrophy. She's lost the ability to talk. She can barely see. She can't eat anymore. She has a G-tube, which we tried to feed her through her stomach, but because of the organ failure, she can't eat through her stomach anymore. So she's connected to an IV line here that goes through her jugular and right at the top of her heart. So she's basically always on this. But the worst part about the disease is that because it's affected so many of her organs, specifically her pancreas, she actually has a hole in her pancreas, and pancreatic fluid leaks out and it touches her other organs. So she's in constant pain every day. She gets a couple hours or maybe a good day once every 2 weeks, which is today. She's having a really good day. But that being said, even though she's having a good day, she is still on many pain medications constantly.
Yeah.
Fentanyl, ketamine, methadone, like very serious medications, just to help her be comfortable.
So she started to have symptoms, at the tender age of 2.
Mm-hmm.
Tell us here. We want to know how did this change your world?
It's changed, like, literally every aspect. Like, I can't even describe it. Her father, Tony, and I have been off of work for about 1.5 years because her care is that intense. It's not something that just we could hire somebody to do. I stay with her at the hospital all day, and he stays with her all night. And we basically we never leave her alone. Right, baby?
Can you tell us, someone out there around the world, not just here in Canada, because Sick Kids Foundation is an incredible facility.
Yeah.
Sick Kids itself. I've personally been a patient of Sick Kids. I suffered with severe asthma. I was in the intensive care for a couple of weeks, and they took good care of me. What kind of advice can you share to our audience, a family out there that's going through something similar like you, that's going through like somebody who has like a rare genetic disorder? What kind of advice can you give that family?
Are you okay, baby? I would tell them to never stop looking. It doesn't matter how rare something is. Sick Kids is a wonderful foundation, and there is an abundance of doctors here who are trying very hard to help Avery. But that being said, right when Tony and I realized how serious this was, we didn't limit ourselves to just the doctors here, as wonderful as they are. We reached out to doctors in many different countries, in France and Italy, in Boston. There's many good hospitals around the world, and I would give parents the advice just to keep being your child's advocate. Don't stop regardless of what someone tells you. Right, baby?
Can you tell us here, you have a GoFundMe page, right?
Yeah.
Can
my
tell
sister,
our audience?
my sister set up a GoFundMe page because you'd be surprised how many things are not covered, even though we live in Canada and a lot of things are very helpful. There's a lot of medical equipment, there's a lot of medicines, there's a lot of special things that Avery needs that are not covered. And my sister set it up because with Tony and I both not working for 1.5 years and staying downtown to be close to Avery because she's so serious, every little bit helps. It helps. Every penny goes directly towards just making sure she's happy and comfortable.
For our audience that wants to volunteer or wants to donate, where can they connect with you? Where can they help you out?
So if you go on the GoFundMe website and just type in Avery Boyanides, she's the only one with that name, then she'll come up. Right, baby?
Thanks again for taking the time out of your schedule to chat with us here.
Thank you. Thanks, Joanna.
Thank you.